Hi, everybody. I'm going to be talking about the DBT consultation team. And this is uh, a talk within the context of an intensive, a DBT 10-day intensive. And I'll be speaking step by step to slides, PowerPoint slides that are for the intensive. And if you were in the most recent intensive with me, in Northampton in 2018. The slides would be beginning on page 67. If you're from another intensive, you can get these from me if you contact me, or maybe you just have them as the slides for the DBT consultation team. Let me introduce it by saying that Linehan put the DBT consultation team in place for a couple of reasons. The most important background is that treating patients with severe and chronic emotion dysregulation can be extremely difficult and can be dysregulating to the therapist. Just this morning, I was consulting to a team, and in particular a therapist who was working with a client who has been dishonest about some very important things. It's somebody with borderline personality disorder, some antisocial features, and it's very frustrating, and she ends up feeling quite helpless. So the consultation had partly to do with how to help her maintain her balance between, on the one hand, connecting with the patient, which she feels she has a good connection, and on the other hand, acknowledging and treating the fact that he is regularly dishonest. I've had patients that I've been frightened of, threats they've made, frustrated with. I've had a patient that made me, whose circumstances made me so extremely sad that I was afraid I would lose my balance. These patients sometimes, based on their own environmental background, can be, they can live in a way that's maladaptive, and they can end up reinforcing maladaptive behaviors by the therapist. In other words, there's all kinds of ways that throw us out of balance in treating these kind of patients. So the idea is that in addition to having a solid mindfulness practice, where you, in a sense, you are your own consultation team, we have a consultation team. Somebody to help us stay in balance. And the two big purposes are to help remain within the boundaries or framework and spirit and principles of DBT, and to become more effective at that and to become more adherent to the model. And the other thing is to help prevent burnout, to help the therapist emotionally regulate. So that's why it comes into being, and it's why Linehan has defined it as an essential part of the treatment. It's not like a supervision that can be there now and then, or for a trainee or something. It is an essential part of the treatment. As she says, DBT is a treatment of a group of people by a group of people through the medium of the individual therapist and the skills group, and of course telephone calls for coaching. So let me get into some more details then about the consultation team. The first slide I'm reading from says the consultation team exists to enhance each member's understanding and adherent practice of DBT, and to maintain and improve the motivation of each member to do DBT. As such, it assesses, make sure that means it means you don't assume. The team assesses, teaches, practices, validates, allows for disagreement, finds synthesis among competing points of view, and elicits positive emotions, at least some of the time, in all members. We're not talking about here validating, teaching, etc. patients. We're talking about doing that with fellow therapists. The next slide says consultation team, therapy for the therapists. Let me make that very clear what that means. That phrase has been used many times about this, and sometimes people misunderstand it. It doesn't mean personal psychotherapy for the therapist. It doesn't mean stripping your professional layer and going at personal issues. It really is about indicating that the team is focusing its attention on helping the therapist. The therapist is focusing his or her attention on helping the patient. So ultimately, the team is helping the patient, but it's through the medium of focusing on each therapist and making them a better therapist, a balanced therapist, a motivated therapist, and a skilled therapist. There are some points to be made about this. One, all DBT therapists and staff must be on a team. You can't be doing what you call comprehensive DBT if you're not on a team. Second, anyone on the team should be doing DBT, not just sitting in. The idea here is that if you're going to expect people to acknowledge the challenging nature of the treatment, acknowledge mistakes they make or things they think are mistakes, and you have to be able to be vulnerable and feel safe in a team. And when you have people that are not practicing DBT and not putting themselves out there, instead they are administrators or therapists that aren't really doing it, they're there to learn or to watch, then you have some people who are not putting themselves in a vulnerable position. And that can make it more difficult for everyone to just be vulnerable. This is not a seminar. It is more like a combat unit, like doing the hard work of treatment and supporting each other in that. Therefore, it helps to have everybody in it. And that doesn't, if somebody's not currently treating a patient or running a skills group, it means they're on their way to that, or they're in between times when they're doing that. Team members agree to come every week and be on time. It's not a drop-in kind of group, and sometimes this is challenging because you have a higher-up administrator who wants to come part of the time because they have a busy schedule. In DBT, we're reluctant to support that idea. You want to have everybody there, on board, and arranging things, and do the extra work of making a schedule that makes that possible. Team members agree to be mindful during team, really to be fully present, to be there, to be interacting, not to be on newspapers, not to be on phones, not to be doing other work while the team is going on. It's really to all be in this together. And finally, team members agree not to discuss team issues outside of team meetings, so there's a degree of confidentiality around what's talked about in the team. The next slide says the team is non-hierarchical, which really means that everybody is working away at trying to do better at their work, and they're presenting their own challenges. And so it isn't like that there are higher ups and lower downs in the team. And that may include a challenging thing is that sometimes in the same team you have a therapist and then you have a supervisor of that therapist or of several therapists. And the idea is that the supervisors also need help. The team leader also needs help. So you don't want to have a hierarchical situation. And so there sometimes is this dialectical challenge that on the one hand, you really want to be able to have everybody let their hair down and talk about what's going on and ask for help of a certain kind, which means you make yourself vulnerable. On the other hand, sometimes people's supervisor is there who writes evaluations that determine the progress of somebody's career. So it's challenging. You have to somehow find a balance where the supervisors agree during the meeting to leave their supervisory role at the door. But then obviously if they're part of the team, they do hear things. So a therapist needs to find the middle path between being aware that the supervisor is going to hear everything and that the team members are going to hear it. And so, you might want to think about the best solutions to that. There's never a complete solution. I mean, you can have a supervisor step out of the room during a discussion, but that in itself could be troubling to a supervisor. It's really, this is just something that has to be balanced and be openly acknowledged and discussed. Next, team members have to be certain that information disclosed in team will not be used against them by supervisors. Again, this is the same issue. Clinical leaders of the team need to get consultation from the team as much as anyone else, and that includes certainly me in my work. The next slide is a big one. It's a big deal. It's the 6 consultation team agreements, so I want to talk a little about them. And these are the agreements that everyone who enters a team, and really a DBT program, but they're really team agreements. What are the agreements that we adhere to as a team to help foster a process that is both effective in helping each other with the things we need help with, and is compassionate and non-judgmental and balanced. So Linehan put together these 6 agreements and defined them, and team members are expected when they join team to go over these agreements and to see if they agree to these agreements or have a discussion about them if there's things they don't agree with, and have it understood why. But generally, you want everybody in the team to have agreed to these. And teams are also, it's recommended that teams every week when they meet go back to one of the agreements, have somebody read one agreement, and then have people share a little if they have thoughts at that point in time about what that agreement means to them, or recent examples of why that agreement was important to them. So what are the 6? I'm going to cover some of them in this video, and then I'm probably going to have to shift to another video in a few minutes. Dialectical agreement is usually listed as the first one. The dialectical agreement is an agreement that there's nobody here who is more the holder of the truth than anyone else. That in any given discussion, in any given case, whether somebody is the newest member of the team, is not as trained up as somebody else, is not the leader of the team, is not the DBT expert that someone else in the team is, that really what people contribute, you never know where the next important statement is coming from. And the truth is evolving. So dialectical agreement, which is the dialectical process, that the truth is evolving in the team. It isn't like we're going to discover that so-and-so has the answer, so-and-so has the truth, and therefore it overrides other people's truths. It's really that the truth is evolving, and when somebody makes one statement, someone else will make another statement, perhaps even the opposite of that statement, and then the team goes forward trying to find the validity in both sides. It also implies that the team is very inclusive, that everybody is in the team. It's not like some people are sitting on the outside. So if you find sometimes that somebody's acting like they have the truth, that could be a violation of this, especially if other team members act like that too. Or act like there's a certain team member that never speaks and therefore never makes a contribution, could be a violation of the dialectical agreement that everybody's on board. Okay. Next agreement, Phenomenological Empathy Agreement. This is an agreement that, given that there are sometimes more than one interpretation to a patient's behavior when you're discussing a patient in team, and let's say 2 different interpretations arise, that the team will be somewhat biased in favor of the interpretation that is more subjectively acceptable to the patient, is more empathic, more grasps for the world from the patient's point of view, as long as there's as much data for that interpretation as any other interpretation. And with full understanding that sometimes you can't weigh in favor of the more empathic interpretation, because sometimes there's plenty of data that there's another interpretation is reasonable, is the better one. If somebody's patient, after preparing for going to an interview, doesn't go, that therapist might say, oh my God, my patient is really jerking me around, is pulling the wool over my eyes, made it seem they'd go. Somebody else might say, well, I wonder if it's just that your patient was frightened about the interview and you haven't really fully quite helped the patient be ready for that. Those are 2 different interpretations, okay? And the latter one probably would be the more empathic one if there's as much data for it. So we're stopping here, and I'll continue in a minute on another video.